This is part three in identifying research gaps in the COVID literature for aspiring scientists. And this one's pretty low hanging fruit. The topic being continued viral kinetics of COVID and its subsequent mutations. The reason it's low hanging fruit is because the methods for this have already been established. You partner with medical institutions and you get a patient's history to narrow down the expected exposure time. And from there, you have your symptoms that develop when they developed, and you have the first positive PCR test, even including the day of first rapid test that's positive. And then you continually test these patients over a set period of time in order to figure out when they are no longer positive on those rapid tests, in addition to when they are no longer positive on the PCR tests. From this type of data collection, you can get the incubation time from initial infection to the first generation of symptoms. You can estimate the infectious period, so a couple days before infection, usually, if you're get these patients from exposure time prior to showing symptoms, then you can get a better scale on this window and estimate the infectious period, and then the post-infectious period when you're still testing positive on that PCR, no longer testing positive on the sensitive rapid antigen testing, and doing this for current variants. So we have a little bit on the original Wuhan strain. We have a lot on Omicron and Delta. We have some on BA1, BA2. We have a little bit on BA4 and BA5 in some of the BQs. We have a little smattering in here of the XBB variants. However, as far as I can tell, there is really nothing on everything else past these initial ones. Whether people aren't interested in it, if there's not the funding for it, if the data has been collected but hasn't been processed and published yet, I don't know. But I have seen statements that at least the US has been less interested in funding this type of study in around 2022, which correlates with the time period where we're seeing a lower smattering of articles being released on this type of stuff. So this would be very beneficial, very valuable information that you would be collecting, and it would be showing how current COVID variants match up against previous COVID variants based off of literature, because the trends seem to be that the incubation time has been getting shorter, the time to initial symptoms is quicker, and you're generating a higher viral load a little later after symptoms seems to be the trend. And from what I've seen, the data suggests that the COVID infection is lasting anywhere from 8 days to 12 days on average, with some people lasting an excessive period of time, like 40 plus days. So, using the previous works, this would essentially be a replicate study, but testing against current variants as opposed to the ones that were in circulation in the past.